right. Good afternoon, everybody. Thank you so much for joining the Walk Cares Fund team and our guest panel for a webinar on home safety and fall prevention. For those of you who aren't familiar, Walk Cares is the state's new long-term care insurance program for workers. And our Walk Cares Conversations webinar series is designed to give you a high-level overview of a topic related to long-term care. I am your host, Kristen Mackey. I am the Community Relations and Outreach Program Manager for Walk Cares, and I would like to go around to our panel and have each person introduce themselves briefly. John, let's start with you.
Yeah, I'm John Barnett. I'm a long-term ARP volunteer living here in Brooklyn. Thank you.
Thank you. Mary Pat.
Good afternoon. I am a registered nurse and a senior planner with Aging and Disability Services, the Area Agency on Aging for Seattle-King County.
Thank you. Stephanie.
Good afternoon. I work for the Department of Health and I'm the Older Adult Falls Prevention Specialist.
Thank you. And Marla.
Hi, yeah, I'm Marla MD, and I am Program Coordinator for Strides for Strong Bones here in Spokane, Washington.
Great. Thank you so much. We are going to start with some remarks from our panel members, and then we will share a brief overview of Walk Cares. Then we'll have an opportunity for audience Q&A. You're welcome to go ahead and answer questions as they come up using the Q&A button on your screen for our panel to answer later in the webinar. And slides and the recording will be posted on our website at walkcaresfund.wa.gov/webinars later today. With that, I am going to go ahead and turn it over to John to get started.
Thank you. Well, I'm going to be speaking from AARP's Home Fit Guide. This is 33 pages of very practical information on how to fix your home for the long term, because people want to age in place. A survey shows that 90% of the 50+ Americans want to age in place. So these are smart ways to make a home comfortable, safe, and great fit for older adults and people of all ages. You can get a free copy. Just go to AARP Home Fit Guide and fill out the information, and AARP will send a free copy of this 33-page publications to you. So these include some modifications that you can do yourself and some modifications in your home that you would have to have hired done. And of course, it incorporates universal design so they can accommodate everyone from toddlers to people in wheelchairs. And starting with the outside, you want to have sufficient exterior lighting. And you want to have at night your house number lit in case 911 has to be called. It's good to know that they will be able to see your house number. And you ought to have at least one 0-step exterior doorway so that you're coming home with a load of groceries, you're not going to trip getting into your home. If you have steep stairs to get into your home, then you might consider putting in a ramp. My colleagues will go into detail about this later. Some people have smart technology. My neighbor does, so with his cell phone, he can figure out everything going on in his home when he's not there. I don't have that, but you might want to consider that. And so when you enter, it's good to have a bench where you can sit down. We lived in Tokyo for many years and took off our shoes. So it's good to have a place where you can sit down and maybe a cabinet where you can store things, place a book for your hat, coat, your handbag, your car keys, and everything right there in the entranceway so that everything is handy and you don't have to search, where did I put my car keys? In the kitchen, some people now work at a lower counter instead of standing at a higher counter for hours preparing food and cleaning up. And it's good to pull out lower shelves. We have those installed so that our lower cabinets, we can just open them, pull out the drawers, and all the dishes and everything are right there. So it makes it a lot easier to find things. Some people put a microwave up above in order to preserve the space on the counter. But we found that people sometimes have very bad accidents when they pull down a cup of hot coffee from above. So we recommend that you keep your microwave on the counter and have your range with controls in front, not in back, where you have to reach over a burner to turn them off and on. Ours are on one side, and I wish they were in front, and I wish they were lit so I can see them better, be sure they're off. It's recommended that you have a French door refrigerator if you're replacing yours, because it opens in the middle and you can see all your food easily. If you go into the bathroom, 70% of falls occur in the bathroom. And of course, this is where the surfaces are hard. So there's 4 things you can do, and I've done some of them myself. One is get a what they call a commode chair, which is essentially armrest on each side of the commode, so you can lower yourself or raise yourself easily. And when I had my hip and knees replaced, this was a big asset to me. And another one is to have a shower bench. We have a shower bench in our shower, and also flexible shower hose, so we can take a shower even sitting down. A toilet riser is helpful also. This is about 8 inches high, plastic item, very cheap. You can just set on top of your commode, and it gives you additional height. And then there's the bath transfer bench, which enables you, if you're still using a bathtub, to get in and out of the bathtub easily without having to stand. So these are some do-it-yourself things. And of course, you want to have horizontal grab bars, not vertical ones. So if we turn to the living space, it's good to anchor all tall furnishings. You know, when we have an earthquake in the Seattle area someday, we don't want a tall bookcase falling on someone. And secure exposed cords to the floor. Have 2 feet of clearance between furniture, and avoid furniture that's sharp and have sharp corners. And of course, secure area rugs to the floor. And know where your dog is. My friend didn't see her dog in the kitchen, tripped over the dog, fell and broke her arm. So it's good to keep tabs of where your pets are. We have rockers, light switches throughout the house, so it's easier to put them switch on and off. And of course, you want to have night lights. On light switches, you need to have light switches at both ends of hallways, and of course at both ends of stairways, and also banisters on both sides of the stairs. And the banisters should extend 2 feet below the last step for safety's sake. And so I think if you're renting, ask your landlord to do some of these things for you. And if they don't want to do it, if they're cheap things, you might want to hire it done yourself, because and it's good to get these things done early so you can enjoy them over the years. My sister had invested $10,000 to install a bathroom on the first floor of a 1909 home. And it enabled her to stay there longer, and then it added to the value when she sold it. So get started on these things early. So lastly, if you want an occupational therapist to come in and check out what you might need, you can contact the American Occupational Therapy Association. And finally, if you want a local certified aging in place specialist, you can contact the National Association of Home Builders. And I know one of these, and I found these very reputable. So that's what I wanted to say, and my colleagues will fill in. Thank you.
Thanks so much, John. We will go to Mary Pat next.
Thank you so much for the invitation to talk about home modification resources. So I'll briefly tell you about the importance of these resources, as we know from experience that many older adults would prefer to age in place. The first one is called Capable, Community Aging in Place, Advancing Better Living for Elders. It is a pilot program that Aging and Disability Services is doing in collaboration with Habitat for Humanity. It's an evidence-based program developed by Johns Hopkins. And the research, which was very robust for this program, shows that it reduces the impact of functional impairments and disability, helps motivate the older adult, those living with disabilities, reduces health disparities, improves emotional health, and actually reduces hospitalization and nursing home days. This pilot there is no cost to eligible King County residents. For those that are interested in the program, the person must be 60 years of age or older, be cognitively intact, able to participate in the program, and this program goes over a period of 5 months. And an occupational therapist is involved. They complete 6 visits over the 5 months. An RN does 4 visits over the 5 months, and a handy person will do the minor home modification, like changing out light bulbs, putting in grab bars, installing raised toilet seats. A person would need some assistance with activities of daily living and be at risk for falls, own their own home, or live with a family member who owns the home, and be medically stable. There is a household income requirement, and I can give all the household income requirement to the folks at Walk Cares. The second program is minor home repair. Minor home repair provides the low-income homeowner home repairs if they have a disability or they're an older adult. Areas include Seattle, Bellevue, Shoreline, Black Diamond, Maple Valley, Enumclaw, Pacific, Algona, Normandy Park, and unincorporated South King County. If a person needs something that is beyond the program ability, they can minor home repair can refer to other programs. There is an income requirement for this as well, and I can share that information with Walk Cares. The labor is free of charge for the most part. However, if there are things like water heaters, these would have to be paid for by the client. And the client will need to be certified, showing that they own their own home and be income eligible. The next program is One Step Ahead. This program is offered by King County Emergency Medical Services Division. It provides free in-home or a virtual visit by a fall prevention health educator, and they will provide a home safety walkthrough to address potential fall hazards, provide education about how to stay safe in your home, also can install safety devices, and to enroll in this program, you must be a resident of King County, and this excludes people living in Seattle, be 50 years of age or older, able to walk with or without an assistive device like a cane or a walker, and be at high risk for falls or have fallen within the past 6 months. And lastly, Rebuilding Together. And this is in Seattle and South Sound. And the area is between Everett and SeaTac along the I-5 corridor. There is an income requirement. Income is really the main criteria. The person would need to plan on remaining in their home for at least the next 3 years, and that's their good faith policy, own their home. They do serve parts of Renton. You must be unable to complete the work on your own, and there is an application online you can complete. Those of us that are involved in fall prevention, particularly nurses, know about the scope and severity. You can have one fall and it can be catastrophic, or you can have multiple falls and have bumps and bruises. So it's really important to get the support that you need so you can safely age in place. Thank you.
Thank you, Mary Pat. And we'll go to Stephanie next.
Hello. So as I mentioned, I'm the older adult falls prevention specialist. Coming up September 23rd, 27th is our National Fall Prevention Awareness Week. So it's an exciting time. We have over 25 events going on across Washington State. You can reach out to me. I will share my contact with Washington Cares if you want to reach out to me to see if there's an event taking place in your neighborhood. I'm going to go over some resources that are available right from the DOH resources website. Sam, do you have my link, or Kirsten?
Sorry, Stephanie, I don't know if we have your link.
Can I share my screen? I probably can't, can I?
Absolutely.
Oh, okay.
Well, let's make sure. Go ahead and give it a shot. See if you can share your screen.
Can you see my screen?
Not yet. There
How
we
about
go.
now? All righty. Yay. All right, let me move some things around so I can see what I'm doing here. All right, so if you go to this, our resources page website, it has all kinds of amazing resources on it. So super easy, navigational. I'm going to go through some of the important links. First off, though, I want to kind of make everybody aware of why we're talking about falls. So this year's theme is From Awareness to Action. And this is the Washington State Governor Proclamation for Falls. And the reason I want to go through this is that you can see how important falls are in Washington State. So I'm going to read it. So stand with me as I say all my whereases. So it is estimated that 17.1% of Washingtonians are 65 years of age and older, and 1/4 of them will suffer falls each year. And whereas 1 of 5 falls causes a serious injury, such as a broken bone or a head injury, and whereas falls can lead to depression, loss of mobility, loss of functional independence, and whereas falls are the leading cause of fatal and non-fatal injuries among this population in Washington State, leading to over 1,100 deaths, 19,827 hospitalizations, and over 93,000 emergency department visits. Those are all in 2023. Whereas falls are the most common cause of TBIs, traumatic brain injuries, among Washington State residents 65 years of age and older, with falls accounting for 66% of fatal traumatic brain injuries among older adults. And whereas the median hospital charges for unintentional fall among Washington State residents 65 and older was $66,462. Whereas the financial toll for older adult falls is expected to increase the population ages and may reach $101 billion nationally by 2030. And whereas injuries from falls are largely preventable through evidence-based methods, such as exercise programs to improve balance and strength, medication management, vision improvement, reduction of home hazards, and fall prevention education. And whereas the Washington State Fall Prevention Coalition is working to increase awareness of this issue and to promote multidisciplinary strategies to prevent falls and encourage people to take steps to protect those who are increased risk of falling, including the Falls Free Checkup available. And then there's a link for that. But what I'm going to do is I'm going to actually go back to my the DOH resources website. We have all kinds of great things here. So this is a tool, if you've never done it, this will take you to the Falls Free Checkup. And I'm not going to go through it, but I'm going to show you how simple it is to do. So it comes up, and what you're going to do is you can fill this out for yourself, or you can fill it out for a family member, loved one, a patient, or a client. You just click on who you're filling it out for. And then there's 12 questions that go through. And once you go through all the questions at the bottom, you're just going to click on Save and Continue. And it's going to give you a printout. If you've answered more than 4, add up more than 4 points on this, it means you're at risk. You can print this out and bring it to your doctor. So I recommend doing that. And then going further down, we have our fall prevention toolkit. So what we have here is all kinds of great flyers that you can print or just open up and look. So I'm just going to click on one, the first one here, 5 simple ways to reduce a fall. So number 1, keep moving. Number 2, talk to your healthcare provider. So if you take your falls free checkup, take that with you. Talking about medications when you go to your doctor and risks for falling, make sure you tell them if you have had a fall. Number 3, keeping your home safe, which we're covering in depth today. And then, of course, getting your vision and hearing checked annually. And then lastly, talking to your family and enlist help to stay safe. Going back to the main website, there's another checklist on fall prevention exercise programs, home modifications, preventing falls and TBIs, talking to your doctor. And then we have our Finding Your Falls Prevention Program flyer. And then from there, I don't know, come back. Let's see what happened. Are y'all still there?
Yep.
Okay, thank you. I moved y'all, so I can't see if I'm still on here. So then from there, we have all these other printed materials, prevention newsletter you can sign up for. I wanted to move down to our fall prevention programs. So this actually goes through all of our exercise programs that we support throughout Washington State. You can click on each of these from a matter of balance, bingo size, enhanced fitness. So all these different evidence-based exercise programs give you more information if you click on the drop-down menu there. And then moving on, we have all of our regional coalitions throughout the state. We have over 10 coalitions on fall prevention and healthy aging. And then let's see what else we have. We have different data that you can look at if you're interested in seeing additional data on falls. And then other resources, we go to other resources. One of the other great resources for fall preventions is the Center for Disease Control and Prevention. So I'm going to take you there. Same thing here. You're going to see that falls free risk checkup. And then there's all kinds of really great data, fall facts, fall prevention resources, interventions. Some of the programs on here is STEADY. STEADY is Stopping Elderly Accidents, Deaths, and Injuries. It's for older adults, healthcare providers, and caregivers. And then we also have Still Going Strong on the CDC website. And that is a campaign that educates about common risk factors for injuries and empowers older adults and caregivers to prevent injuries. So I will make sure that Walk Here gets these links for this. And I'll be happy to answer any questions at the end of the presentation.
Great. Thank you, Stephanie. And we'll go to Marla next.
And you'll be sharing my screen, right? Or my slides?
Yep, pulling them up right now. Just 1 minute. All right. Can everybody see that?
Yep.
Great.
All right. Go ahead and forward. Again, my name is Marla, MD. I'm here in Spokane, Washington. I'm with Strides for Strong Bones, and we are a nonprofit that work with physicians in the area, with education for the general public. And I'd like today to talk about bone health and fracture prevention, as it's a really big part of maintaining and building bone and bone health for our long-term future. So go ahead, next. I do have one disclosure. I also work at the Washington State Department of Health in the EMS trauma section, and I'm an injury prevention specialist there. Next. So just a little bit about building and maintaining bone for life. Our peak bone mass is accumulated as a peak between the ages of 25 and 30, and most of our bone is acquired during puberty. So again, very important to lay down as much as we can when we're young. So encourage our children, grandchildren, all of us to stay active, physically active, encourage a healthy, nutrient-dense diet, and then also make sure we're getting enough calcium. Next. So maintaining a healthy lifestyle as an adult, after we've laid down all of our bone, we want to try to keep as much as we can as we go through our life. Again, a healthy lifestyle includes not smoking, limiting our alcohol consumption, exercise, eating well, getting enough protein, especially older adults may require even a little bit more protein than normal adults. And then also getting enough calcium and vitamin D in our diet. Go ahead, next. So let's talk a little bit about calcium. It is a mineral that's found in many of our foods in our diet, and more than 99% of our body's calcium is in the skeleton. So it's an important mineral that we need. It helps build strong bones and teeth. It can help prevent osteoporosis. It helps our muscles function properly. And then calcium in our food is the best, but supplements can also help. As far as our daily recommended amounts for better absorption, we also prefer to take calcium in 2 to 3 times daily. So breaking that up for older adult women under age 50, that would be 1,000 milligrams a day, or maybe 2 times 500 milligrams a day. So breaking that up into 2 different sections for the day. Women ages 50 and older, 1,200 milligrams a day. Men under age 71, 1,000 milligrams daily. And men over age 71, 1,200 milligrams daily. Go ahead, next. So these are some examples of some calcium-rich food sources. Again, many prefer not to do dairy products. There are many options if that's your dietary choice. But chickpeas, red beans, white beans, all your hard cheeses, milk and dairy are good bang for the buck as far as calcium, but there are plenty of other options. So next slide. And vitamin D is also a really important component for building bone. It helps with calcium absorption in the foods we eat. It's also considered a hormone, really, that is created from in the skin from sunlight. So getting as much sunlight as we can in those summer months, or not as much as we can, but adequate amounts, which could be, excuse me, anywhere from 5 to 30 minutes a day is enough to create some vitamin D through our skin. It helps with bone mineralization and muscle function. And then few foods are actually rich in vitamin D naturally. So supplementation can be very important. Next slide. So how much vitamin D do we need? Adults under age 50, 400 to 800 international units daily. Adults over age 50, 800 to 1,000 international units daily. And again, these are some of the foods, and very few that have naturally vitamin D. And as you notice, the shiitake mushrooms, because they're sun-dried, is a very large 1,600 IUs. Those are some of the foods that are rich in vitamin D. So next slide. Preventing fractures. So this is, again, bone health is something that doesn't get enough visibility many times. And osteoporosis increases your risk for fracture if you fall. So keeping your bones as strong as possible is important. Osteoporosis, if you're not sure what it is, it's a condition that results in thin and fragile bones that can easily break, even from just a minor fall from a standing height. Usually there are no outward symptoms. You can't really see osteoporosis, so many don't know that they have it until, unfortunately, they've suffered a fracture. There is a bone density test that determines if you have osteoporosis, and it uses an X-ray scan. It's called a DEXA, to measure the amount of calcium and other minerals within your bones. And it's something that you may want to ask your doctor to look at some of your risk factors for osteoporosis. And there are treatment options out there that are safe and efficacious if necessary. And next slide. So keep your bones strong. Again, protect ourselves if we do fall, with strong bones. And again, that healthy lifestyle with avoiding our smoking, limiting alcohol use, get enough calcium and vitamin D, adequate protein, exercise, and this includes weight-bearing activities, cardiovascular or endurance activities, balance, and strength. So those are components of exercise that we should all be getting. Ask your doctor about risk factors for osteoporosis if you're an older adult or if you've gone through menopause early. And then medications may be necessary, and there are medications that slow bone loss, help build bone, and reduce fractures. And I think that is our last slide. I've got some resources there and little tidbit, hopefully a few nuggets for you to take with you on how your bones need to stay healthy for a lifetime. Thank you.
Thank you so much. Okay, with that, we will go ahead and move into the WalkCares section. So WalkCares is a long-term care program for Washington workers. It's an earned benefit, so you contribute for a certain number of years in order to qualify for benefits. It's entirely self-funded by worker contributions, which go into a dedicated trust fund used only for this program. Workers contribute 0.58% of each paycheck to WalkCares, and you can see at the bottom left here what this looks like for the typical worker who makes just over $50,000 a year and would contribute $291 each year, or about $24 per month. You only contribute to WalkCares while you're working. Contributions stop when you retire or if you become unemployed. And everyone is covered at the same rate, regardless of pre-existing conditions. When it comes time to claim your benefits, there are no copays or deductibles, and you don't need to file claims and pay upfront for services. Instead, we connect you with contracted providers for the services that you want and pay those providers directly. Contributions to the program began in July 2023, and benefits will become available in July 2026. This is what contributions look like over the course of a career. And you can see that that typical worker income is just about at the level in green here in the middle. And you can see that $290 in contributions each year totals out at $8,700 over 30 years. Everyone who is contributing to WalkCares more than 500 hours per year is earning benefits, part-time and temporary workers included. And by contributing for a certain number of years, you earn access to the $36,500 benefit, which grows over time with inflation. There are 3 pathways to meeting the contribution requirement. The first is lifetime access, and this is the pathway that we expect most Washington workers will use to qualify for benefits. To use this pathway, workers must contribute for 10 years without a break of 5 or more consecutive years. This pathway earns you access to the full benefit amount, which again is $36,500, lifetime amount adjusted for inflation. Then the next is early access. This is for workers who have not yet been able to earn lifetime access, but have a care need while they're working or soon after they leave work. To qualify, you need to have contributed for at least 3 of the past 6 years at the time that you need care and apply for benefits. And this pathway also earns you access to the full benefit amount. Then finally, we have a special pathway that is just for people near retirement. If you were born before 1968 and are therefore near retirement as the program begins and unlikely to qualify for the 10 years pathway, you can still earn 10% of the benefit amount for each year that you work. So for example, if you work and contribute for 500 hours or more per year for 3 years, you would earn 30% of the benefit amount, or just under $11,000, which also grows with inflation. New retirees have permanent access to whatever percentage of the benefit amount they earn at any time that they need care. and they are also able to qualify through one of the other pathways if they meet those requirements. Once workers have met contribution requirements and need help with at least 3 activities of daily living, they can get access to their benefit amount, which they can use as essentially a budget for services and supports of their choice. With Walk Cares, you get the flexibility to choose the services and supports that meet your needs. So that could mean in-home or residential care, but it could also include things like home modifications to make your home safer, like we've talked about in this webinar, as well as assistive technology for things like medication reminders and fall detection that can help with some care needs. Walk Cares is really designed to help people age in place in their own homes as long as possible. That's what almost all of us want to do, and most of us can if we have the right supports in place. Walk Cares also has many options that provide support for family caregivers. You can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, even your spouse. And Walk Cares can also help lessen the impact of care responsibilities on family caregivers by paying them for their time or making sure that they can get other support services. We get asked a lot about how far the benefit amount will go, and while it won't cover 100% of care for everyone, it would cover the amount of in-home care the average Medicaid client uses right now for roughly a year. About a third of people need care for a year or less, and for those people, Walk Cares may be able to cover all the care that they need. For others, Walk Cares provides the family with immediate relief and time to plan for future care costs. So these are just a few examples of how someone might use their benefit. You could pay a family member to care for you for about 10 hours per week for 2 years and get care supplies for a total of about $33,500. Or you could choose services to help you stay safely in your own home. You could purchase $15,000 worth of renovations like bathroom modifications or a wheelchair ramp to improve your home's accessibility, get an electric wheelchair or scooter, and have meals delivered for 3 years for around $26,800. Or someone who needs long-term care due to an unexpected injury could get 20 hours of in-home care per week for a year, plus transportation to appointments and crutches for about $34,600. We also have some great news from this year's legislative session. The legislature passed a new law this year allowing people to take their Walk Cares benefit with them if they move out of state. So under the new law, starting in July 2026, Washington workers can choose to continue participating in Walk Cares if they move out of state. And to become an out-of-state participant, workers must have contributed to Walk Cares for at least 3 years, in which you worked at least 500 hours per year, and must opt in within a year of leaving Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years. And the state will create a process for out-of-state participants to report their earnings and pay premiums with a focus on making it easy for participants to do that reporting. And then benefits will become available for out-of-state participants starting in July 2030. And with that, we are going to go ahead and do our audience Q&A. So let me pull that up. And if you have a question that you haven't put into the Q&A yet, please go ahead and do that now. I see we have a question from Marla asking to restate the different kinds of exercise.
Sorry, I need to unmute. So we do need some weight bearing exercise and even a little bit of jumping, jump rope. We need strength training, so we need to do things that strengthen our muscles as well. And then we need the balance component as well. Many of the evidence-based falls prevention classes that Stephanie mentioned have balance components to them as well. And then we also need cardiovascular and aerobic endurance type work as well. So there's 4 major components to the right kind of exercise. And I know the CDC recommends about 150 minutes a week of exercise, and that can be easily split up into about 30 minutes a day as well. So yeah, that kind of covers the big picture of it. So not so much, 30 minutes a day, that would do it.
Great, thank you. And And we've got someone asking about whether the materials will be emailed to participants after the session, along with the session recording. I'm going to drop in the chat the link where you'll be able to find the materials. We'll include some of those links that were showed, as well as the slides. And we will, it's not actually letting me send a chat to everyone. So Sam, if you can put a link to the webinars page in the chat for folks, that would be great. And you will be able to access the recording as well as those materials on that web page later today. And then we've got someone asking about, for WACARES, for out-of-state participants, what does opting in within a year of leaving the state mean? And does that mean you have to need the care within a year? No, it does not. It just means that you have to notify us that you would like to continue participating in WACARES. So there'll be a process where you'll just let us know, I'm leaving the state, I want to continue participating, and then we'll be able to get you information about reporting so that you can continue participating in the program. And we've got someone saying, John mentioned some in-home assessments on the AARP website. Can you provide that link? John, if you happen to have that handy, we could drop it in the chat, or we can include it with the materials after the webinar is over.
Well, may I just say that just go to the website, AARP Home Fit Guide, and it will show you can download it or you can get a free copy mailed to you. And I suggest that you get the 33-page free copy mailed to you.
Great. And then we've got someone asking, can you elaborate on the funding sources and partnerships that led to the creation of the programs featured, Capable, Minor Home Repair, etc. I'm an aging and family case coordinator in San Juan County, and those programs are not available in our county. So I think that's one for you, Mary Pat.
Thank you. I will say that our Area Agency on Aging is always trying to look at groundbreaking or evidence-based programs that we can bring and pilot them. I do want to shout out to our state partners. Marla and Stephanie are incredible, and we have talked about, could we do Capable statewide, and what might that take? And so I think there is discussion around if there is interest, if we were able to get occupational therapists and registered nurses and home repair companies, or even if they could partner with Habitat for Humanity, could we get that going around the state? So I just want to let you know there is conversation around that. Some of the things, like One Step Ahead, as I said, is within King County, but Marla and Stephanie are incredible advocates and supports for our King County Fall Coalition. And we are really trying to make this a stronger, more healthier Washington, a more age-friendly Washington. So you have great champions, all of you on the call here. We are so blessed and fortunate to have Stephanie and Marla to really spearhead a lot of programs, as well as other members of Department of Health and Aging and Long-Term Care Services. So if there is a need around the state, let your partners know, and we will do our best to support you. Thank you.
Great. All right. And we've got somebody asking whether WACARES is available for seniors who already retired. Unfortunately, if you are retired and are not working at all anymore, I know some people will work a little bit part-time in retirement after they've retired from their primary career. But if you're not working at all, because WACARES is an earned benefit, you won't be able to get WACARES benefits. For that, we really recommend reaching out to your local area agency on aging. They may be able to help you with some other resources in your area that would be useful for you. And then let's see, we've got a question about resources for programs in the Clallam County area. Would area agencies on aging be a good resource for that, Mary Pat?
Yes.
Okay, great. And we'll drop in the chat a link to find your local area agency on aging. Just 1 minute. Okay. We've got a lot of folks who are still interested in links. And we will again make sure that those are posted with the slides for the folks that are asking for some of the links that have already been mentioned. And I think that brings us to the end of our questions, unless anyone wants to enter something last minute.
I just wanted to mention also, I want to do a big shout out to both Mary Pat and John as well. I appreciate the shout out, Mary Pat, but you and John have both done so much work over the years, and we appreciate all of your hard work out there. And in any way we can support you all, that would be fantastic. So yeah, just great job out there over the years. Yes.
Thank you so much. Okay, that brings us to the end of our presentation. I am going to share my screen one more time to show you some contact information in case you have additional questions. So again, you can find the webinar materials on our website at wcaresfund.wa.gov/webinars. And if you have any questions that come up later on, you can always contact us by email using the link on your screen on our website. That'll send your email to the agency that's best equipped to answer your questions. Or you can contact us by phone at the numbers on your screen as well. And those are also on the contact page on the website. Thank you all so much for making time to learn a little bit more about home safety and fall prevention today. And we look forward to seeing you at our next webinar. Have a great afternoon, everybody.
Thank you for your time, everybody.
Thank you.